Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. We've had some very interesting questions that have come up relative to what I would call complex eye disorders and treatments. And we have two experts here. We have Dr. Georgescu, he calls himself Dr. Dan. Seems that nobody can say his last name correctly, but I think I got pretty close. And he's a physician with a Ph.D., and he's going to tell us what it's in. And he's very interesting, a multifaceted individual that does orbital lacrimal surgery, and he does facial plastic surgery, ocular, and interesting, very interesting. And my other guest is Dr. Elise Kramer, who is a optometrist, and she too is very interesting. She's an expert in optometric and a contact lens specialist, and she's a fellow of the Academy of Optometry. Welcome.
Thank you.
Both of you.
Thank you. Thank you for having us.
So we do have a lot of questions from people that some of them sound like oversimplistic questions, but they're not oversimplistic when it comes to the care. So let's just talk about eye care. Tell me what you do, Dr. Dan, because I know that some of the work you do is rather spectacular.
So what I do is very subspecialized. It's called oculo-facial plastic surgery, and it's a subspecialty of ophthalmology. So I deal with the eyelids, the eye adnexa, what it's called, that involves the orbit, the lacrimal system, the eyelids, so all the structures around the eye that are protecting the eye and they're ensuring that the eye functions properly. So as an oculofacial plastic surgeon, I deal with droopy eyelids, eyelids that are turned in, out, they don't function properly, with patients that have tearing or very dry eyes, and different diseases of the eye socket, which is called the orbit. So in the orbit, you can have tumors, you can have infections, trauma, inflammations, and all these diseases fall into the realm of the oculofacial plastic specialty, which is an ophthalmology subspecialty. So patients that have lost their sensation in the eye, and they develop a disease called neurotrophic keratopathy, and that happens from a damage to the trigeminal nerve. That's the nerve that provides sensation to the eye. And Dr. Kramer will talk about one treatment for that condition. What I do as a surgeon, I'm trying to reconstitute the sensation, to give them back the sensation to the eye so they can actually protect the eye and feel when something is in the eye. And also these nerves that give you sensation, they also have a neurotrophic role, and they basically feed the eye surface. And it's a very common problem. There are a lot of patients that have lost sensation to their eye from infections such as herpes, herpes simplex, herpes zoster, from trauma. And in my case, I see a lot of patients that had brain tumors that have lost their trigeminal nerve at the same time with the facial nerve. So the patients that cannot protect their eye because the eye muscles don't function, so they cannot close their eyes. And in the same time, they're not aware that the eye is dry. So they cannot protect the eye because they're missing the two main mechanisms to do that. So these patients, unless they're treated immediately, they can lose their vision. And what we've been doing actually for the past, let's say 20, 30 years, we were able to treat the facial palsy with procedures called facial reanimation, where we transfer nerves or muscles with the nerves back to the face to reanimate the face so the face can move and the eye would close. But we weren't able to treat the lack of sensation. And recently, in the past couple of years, we have developed techniques where we can actually transfer sensory nerves back to the eye, back to the cornea, so they are aware that the eye gets dry and they can protect it.
Do you do these multiple procedures in a ambulatory surgical venue, your office, or do you do it within a hospital structure?
It is not in the office, but it is an outpatient procedure. It can be done in the hospital, it can be done in a surgery center, but it's an outpatient procedure that takes anywhere between 1 and 3 hours, depending on how complex and how much we're doing. For example, if I do the facial reanimation and I do the corneal neurotization at the same time, it's a 3-hour procedure. But if I do one of them or a couple of small parts of them, then it can be a 1-hour procedure. But regardless, the patients go home the same day.
That's why I asked the question, because a lot of folks worry, rightfully, wrongfully, justly, unjustly, about who is doing the anesthesia.
That's a very good question. Actually, all of us, we're general plastic, oculofacial plastic, or facial plastic surgeons, we all work with anesthesiology specialists. So we all have a nurse anesthetist or an MD anesthesiologist who will take care of the anesthesia. We do the local anesthesia, but we have a specialist that does the general anesthesia. If it's necessary, most of the time we can do it with some sedations, light IV sedation. But we work as a team.
Okay. Dr. Kramer, you are a contact lens specialist and an optometrist, obviously. So tell me about your field of activity, and just let us know.
So I'm also very subspecialized. I specialize in anterior segment disease, dry eye, and I specialize in designing contact lenses. So what that means is you were talking a lot about, patients buying things online. This is not what we do. We don't sell contact lenses, so really design them. For patients, some patients can't wear contact lenses, regular lenses that you can buy on the market. They can't wear glasses because they can't see with them, because they have very irregular shaped corneas. They have irregularities in their eyes, either because they were born that way, they've developed a disease, they've done surgery in the past, and they end up with something that they can't wear normal contact lenses, or they can't wear glasses and see properly. So what we do is we design contact lenses for these patients based on the shape of their eye, the shape of their cornea, and every lens that we design is completely unique and individualized for the patient that we're treating. Dr. Dan was talking about a condition like neurotrophic keratopathy, in which patients don't feel that their eyes are very dry because they've had, cranial nerve palsy. So in those cases, what we do is we design what's called a scleral lens. And the scleral lens is very specialized type of lens that doesn't sit on the cornea, which is the transparent layer on the front surface of the eye. It actually sits on the white part of the eye. And it's filled with liquid, and that liquid can restore and protect the ocular surface. And so not only do we correct vision with these special types of contact lenses, but we can also protect the ocular surface and restore it for when it's been damaged from disease or previous surgery. And so we have a whole host of dry eye treatments as well that we do in the office. And so we really focus on that. Our patients who come to us, many of them are referred from other optometrists who don't do this type of work, or from ophthalmologists. And we work as a team, just like Dr. Dan was mentioning with anesthesiologists. We work as a team with other doctors to provide, specialized contact lenses or treatments to help in these refractory cases.
Let me ask you an oversimplistic question, because I can hear it from the audience right now. If it's not something that is already pre-stocked, whatever it might be, and they have to be customized, who actually does the manufacturing and the customization? What is there a special venue that it's not, obviously not done in your office?
So that's a very good question, and I explain this to patients on a regular basis. Basically, I compare it a lot to having an irregularly shaped foot and trying to buy a pair of shoes. So if a patient, if someone wants to buy shoes but their foot is shaped weird, they can't necessarily go to any department store and buy a pair of shoes off the shelf because they'll be very uncomfortable, they may have pain, they won't be able to walk. And so we design like a special shoe for the specific shape of this person's foot. It's very similar. If they can't buy a regular contact lens online because it won't fit properly, they'll be uncomfortable, they may have pain, they won't see well. And so in those cases, they come to us. We take a lot of different measurements that are not done in regular optometry offices. We measure the front surface of the cornea, we measure the scleral, which is the white part of the eye. We do specialty refractions, and we have diagnostic lenses in the office that we put on the eye. It's like if you were getting a custom suit made. You go to a suit store, they put a suit on you, and they tailor it to the shape of your body. So very similar. So we have diagnostic lenses in the office that we put on our patients' eyes, and then we use all that information, and we have various labs that we work with. Most of them are located in the US, and we share that information with the lab, and they send us the product. Now, when we receive that product, we put it on our patients and then make further changes. A lot of the time, many times, these lenses have to be tweaked until we finalize them when we've reached that point where no more changes have to be made. But it's a process, and a lot of the time, it's very worth it for our patients.
I would assume it's your capabilities, your techniques within your practice that enables you to take what is sent to you from these specialized labs and then, in essence, finesse the product for the comfort of your patient.
Exactly. Couldn't have said it better myself.
That's the way it happens?
That's exactly how it happens. We oftentimes we request something, it comes back, but when we put it on, it doesn't fit quite as we wanted it to, or there's still some room for improvement, and so then we further tweak it. It's happened before that it's, the first time it just works, but I would say that most of the time we do have to make further changes.
Right. Dr. Dan, we're back to you. You mentioned before the issue of the, most people don't realize the nerves that control eyesight, and the brain figures out what the nerves are telling them, and that's what they see. But there's been a number of comments that have come from folks that have had shingles. And, of course, often, it's very interesting. The shingles, for some reason, ends up either in primary care physicians or in a dermatology office. They somehow, that's where they end up, at least the most that I've heard.
Right.
And the greatest fear is introduction into the nerves surrounding or presenting itself for eye service. What is the situation? Do they treat that shingles? I should say the attack by the viral nature of it, and then you work with whatever the results are?
Now, in fact, all the patients that have shingles in the trigeminal nerve dermatome, so on the face, the eyelids, need to see an ophthalmologist, because that infection can actually get into your eye and can affect not only the surface, giving you a keratopathy or neurotrophic keratopathy, but it can actually get inside the eye. You can get retinitis, acute retinal necrosis, you can get uveitis. So it's imperative that all patients that have shingles on their face, around the eye, see an eye specialist. We work with a lot of dermatologists, we work with primary care physicians. They are all aware that when shingles affects any structures around the eyes, it could also affect the eye itself. So they know to refer these patients to us, and it doesn't have to be an oculofacial plastic surgeon like myself. It can be a general ophthalmologist, can be an optometrist. We're all able to diagnose any infection, any shingles infection inside the eye. But this can be very serious. It can be life-threatening, and something like acute retinal necrosis can, especially if the patient is immunocompromised, can lead to permanent loss of vision. So definitely patients need to see an ophthalmologist or optometrist or any other eye specialist immediately.
Yeah, a lot of the reference that I'm making is that like I said, this show is driven by questions that comes from the people that have been watching us for the last 20 years. And a couple of the questions that came were the immediacy of the response of the physician that, I guess, either through his or her medical knowledge says, listen, I want you to see an ophthalmologist immediately, and I want you to see them every single day until this is cleared up, because you have a danger of causing harm to one of the optic nerves, and then you got a real problem.
Absolutely. And the neurotrophic keratopathy that we're talking about actually happens after the acute infection, when the trigeminal nerve is permanently damaged. So it's a sensory nerve. So the eye can see, the structure of the eye is intact. However, the sensory nerve, the long ciliary nerves from the trigeminal nerve, they don't function as they used to because of this viral infection. And herpes is one of the most common ones, but there are other viruses. And once that happens, the patients need to see a specialist. Either immediately they can see a specialist like Dr. Kramer, who does contact lenses to protect their eye, or they need a tarsorrhaphy, which is closing the eye with a temporary suture to protect the cornea. What happens is, if they're not aware that the eye is dry, they can lose their cornea and the eye itself in a matter of a few days. So we need to be aware that patients that have a herpetic infection, in addition to the patients who have tumors or trauma, they can lose their sensation, and that has to be treated immediately before they get surgery, surgical corneal neurotization, or other procedures to restore their sensation. But they have to be managed immediately before they develop a scar, because once they have a scar on their cornea, it's already too late. And that requires usually a corneal transplant. But what we have found actually with our procedure, which is absolutely amazing, and I couldn't believe it the first time I've done it, which was a year ago, some of these patients that have very dense corneal scarring, they recover vision from count fingers to 20/40, which is driving vision. And that was kind of unexpected, because what we've seen so far, there's another medication called Oxervate. It's a nerve growth factor that has been in FDA trials recently, and that also seems to improve the corneal surface, not the sensation, but just the surface through the neurotrophicity. We've seen some improvement in vision, but with a nerve transfer, we actually were able to restore the vision from basically blind, count fingers at face to driving vision. And some of these patients, they actually don't need a corneal transplant anymore, which was amazing. And this happened in a matter of, let's say, a month to 6 weeks.
I always tell the folks, if something is unusual and you just feel something, don't just sit there. You got to speak to your doctors. You got to get there.
Absolutely.
Because the only way that you can gain access to trained knowledge is by reporting it to someone who will refer you to the proper venue. Correct?
Yes, and it's always easier to prevent something than to treat it.
Well, to treat it immediately.
Right.
That's the easy way.
Absolutely.
Dr. Kramer, I would assume that knowing the interests in your practice, that a lot of people will come to you and ask for what I would call plastic surgery intervention. I would assume that it's that at that point in time that you would refer to someone like Dr. Dan.
Absolutely. So Dr. Dan and I work together very much. We deal with the same kind of surface. So we both specialize in the anterior segment in a certain way. He specializes in eyelids, and that's very, very connected to the surface of the eye. And so a lot of patients that come to me have complaints, whether they're cosmetic or functional, and Dr. Dan is someone that I refer to very often to help these patients. Again, whether it's cosmetic or functional. So some of these patients may have a droopy eyelid that doesn't only bother them because of the way they look, but also they can't see properly because it's covering part of the eye. And so Dr. Dan is someone who can help with that, for sure.
You know, I think people rightfully, I mean, a lot of people might come to you, and this is not an assumption, just what I feel, is that people might come to you because they don't look, you know, there are so many ads on television. I mean, I would say, I mean, I don't watch that much television because I'm not there to watch that much television. But every single time there's something on there about putting something on and getting rid of the bags under your eyes, the droopy eyelids, or this and that and everything. When the reality is, they should really do themselves a favor and see a professional. I have nothing wrong with the entrepreneurial interest of individuals that want to sell their products, but the bottom line is that they may cause themselves more problems than they are expecting.
And I want to add to that, actually. It's a very important point, very good point. I had a patient that I saw this year who had, eyelids. She wanted to raise her eyelids for cosmetic reasons. And this was before I ever saw her, but she ended up doing it with a podiatrist, a foot doctor. And she ended up with severe, exposure of the eye because they cut too much tissue off. So she couldn't close her eye properly. And so this is a situation that could be completely avoided by going to someone specialized in eyelid surgery. I think that every doctor could be great at what they do, but there are limits. Do you know what I mean? And I think that if I had to do eyelid surgery, the best person to go to would be an eyelid specialist. And as you said, you can end up doing more damage than you had prior to surgery if you go to the first ad that you find, or try to find something with a great discount, or regardless of what it may be. So I think it's very important to see the right person for the right procedure. And so what I did with this patient is I ended up trying to protect the ocular surface by putting what I was talking about before, a scleral lens, to help her with that exposure that she had. But that could have been avoided, for sure.
We're down to the last 4 minutes of this show, believe it or not. But I'd like to, if people want to see Dr. Elise Kramer, how do they reach you?
So there's two institutes. There's the Miami Contact Lens Institute and the Weston Contact Lens Institute. And they can find us online on Google, Facebook, Instagram. And,
okay. Yeah. Something like that?
Something like that.
Okay. And Dr. Dan?
They can easily find me in Fort Lauderdale, in my office, the main office in Fort Lauderdale. And
where is your office in Fort Lauderdale?
It's at in the Imperial Point Medical Arts Building.
Where is
on
it?
US 1. It's on US 1.
US 1?
Yes.
Near where?
Cypress Creek. Very close. Cypress Creek.
Cypress Creek Road.
Road,
right,
yes.
So.
Very close to Pinecrest
I was going to say, you see,
that's right.
That's the epicenter of Pinecrest. Well, there's some great restaurants on down that street. Let me just let you know. See, I have a life too. You see, I really am very interested because a lot of the people who asked us questions were very, very precise. Now we have a lot of folks that view us who are in the last quartile of their life. And dominantly, to tell you the truth, they're much more interested in the ability of their vision care, rather than in the cosmetic issues, to be very candid. But a lot of times, what they perceive to be the cosmetic issue is really part of the vision care.
That's a phenomenal point. So none of my patients is 100% functional or 100% cosmetic. Everything that I do is a combination, it's a mix of the two. Because with the eyelids in particular, and many other parts of our faces and bodies, you can't, for example, do a cosmetic blepharoplasty and not take into account the functional role of the eyelid in protecting the eye. So the eyelids have to function better after your surgery, whether it's cosmetic or functional, than before. And the same with, let's say, if I do a ptosis surgery, okay, for a droopy eyelids. Well, those eyelids will look a lot better. I mean, this procedure has a significant cosmetic impact on that person's appearance. So I think nothing that I can't think of a single procedure that I do that's 100% functional, 100% cosmetic. And the way we do it is to, first of all, make sure that those eyelids, they function better than before. And second, that they look better.
Eyesight is really a dominant force in what I would call a continuum of life. I mean, people don't retire at a position where they can't do what they want to do. You know, can't even go to a restaurant to read a menu. I mean, you just can't. You can't drive. A lot of things. So that was their interest. So I'm glad that both of you have come here. I appreciate both of you being here, and I hope that we get to see you more often. Folks, I hope we answered some of the questions that you brought to us. This was a little bit more technical than perhaps the oversimplistic, yet very direct questions that you asked about droopy eyes and how do I make myself look better, and dry eye and things of that nature. But it's very complicated, and I hope that we brought it to your attention. Dr. Dan, who is an MD, Ph.D., and he is certainly very qualified. He told you where he's at. We can't put up phone numbers, but you can look it up. As Dr. Kramer said, Google it. And if you can't Google them, get your neighbor to Google them. And Dr. Kramer, Elise Kramer, who is an optometrist and has a very specialized practice. And she obviously is an optometrist, and she has a very unique contact lens specialty practice. We thank you, both of you, for being here.
Thank you very much.
Remember, folks, I always tell you, you got to take good care of yourself. But the most important thing for you to do is to communicate with your physicians. Let your physician know that you've seen something here that maybe they did not that they didn't understand, but maybe they didn't have the immediate knowledge to the fact that we have a Dr. Dan and Dr. Kramer sitting here. You need to tell them. And I would appreciate you taking good care of yourself and making sure that you just don't let things go by. And if you all of a sudden you have dry eye, for example, just don't walk into a supermarket or a pharmacy and expect to cure everything without communicating with your physician. So that's an oversimplistic mandate that I'm offering to you, and I'm just saying to you, take good care of yourself. This program comes to you from Nova Southeastern University. If you have a question or otherwise, there's a telephone number, an email address right there. And remember, we're proud to come back into your living room every week. And my name is Fred Lippman. Until next time, see you.